So my name is Simon Houston. I'm a respirologist working at the QE2 at the Halifax Infirmary, and I see patients with respiratory disease, and particularly patients that are presenting with new probable lung cancer. So endobronchial ultrasound is an advanced kind of bronchoscopy. It's a procedure where we're able to put a camera down into someone's airway, and ultrasound allows us to look through tissues so that we can visualize structures that are outside of the usual views of the airway. And this allows us to biopsy structures deep inside the chest using a minimally invasive approach. The wait times for patients in Nova Scotia are really quite poor compared to other academic centres in Canada. Patients can expect to wait weeks to months longer than they should based on national standards. So we really do have major challenges in getting patients to EBUS that need the procedure. So I think that having additional endobronchial ultrasound equipment will allow us to maximize the amount of time that we have to do these procedures. It will allow us to have scopes available for patients for the procedure. It will allow us to continue doing procedures in the event that one of our scopes is damaged or needs repair. And I think that it's a relatively inexpensive way of making a big difference for a large number of patients that are waiting for urgent procedures. The patients that are told they probably have lung cancer and are waiting for further evaluation are in an incredibly stressful period. It's a very difficult thing to be waiting at home for a call to get a procedure that's going to help patients get to treatment. And so there really is a big impact on patients in that way, and I think that's important to remember. We have studies now showing that early diagnosis of cancer leads to better outcomes and can improve survival. I think that it's important to understand that patients with lung cancer know that there's a ticking clock, that their disease will progress or they can become sicker while they're waiting to get on treatment, and that getting patients to treatment faster is beneficial in terms of avoiding some of those complications and making sure people can get the therapy that's available to them. When patients become too sick, or if their cancer progresses, it changes the types of treatments that are available and lessens the chance of them having a cure in some cases. Every case that we see of patients that are waiting for cancer, I think, are incredibly grateful that they can have their diagnosis in a way that doesn't require a more invasive procedure, that we help them get on track with their care. So every case that we see is important, but every time that we do this procedure, we're helping someone get farther down the path to getting treatment and potentially cured. And it does make a huge difference to a large number of patients every week. It is an advanced kind of bronchoscopy that helps us with other conditions as well. It's an easy way to make a big impact with a relatively small amount of money because we are so desperate to get more resources in this area. And so if you're looking for a way to have a big impact on patients very quickly, I think EBUS is a very worthwhile place to be putting money. Outcomes for lung cancer in patients in Nova Scotia are some of the poorest in Canada, and a big part of that has to do with access to care. So spending resources in a way that will allow a large number of patients to get faster access to care has the potential to make a big difference for patients, both in terms of their cancer outcomes, but also in terms of their well-being while they're forced to wait for the care that they need. It would be great if you can help support this campaign. Your donation can ensure that patients with lung cancer can get the treatment that they need when they need it.
I'm Danny French. I'm one of the thoracic surgeons at the QE2 in Halifax. I work predominantly with lung cancer, managing patients from initial diagnosis through to the treatment and including surgery and surveillance of them after they've been treated for lung cancer. I work with the Nova Scotia Lung Association on the Medical Advisory Board. So endobronchial ultrasound allows us to sample lymph nodes which are in the mediastinum, which are in the central aspect of the chest, which are very hard to sample by another means. And with this we can do two things. One, we can sample the tissue, which can give us name the disease, which is key in terms of moving forward with treatment. And the second thing it can do is stage the disease, which tells us how it should be treated. And this is a very critical step in trying to get optimal care for lung cancer. It replaces a more invasive test called mediastinoscopy, where patients require general anesthetic and have to have sharp instruments placed near large vessels in their body, which does come with the risk of major bleeding. The risk of bleeding with endobronchial ultrasound is much less, and therefore we can achieve both a tissue diagnosis and an accurate stage of the disease using minimally invasive techniques. There has Since we started the endobronchial ultrasound program, there has been fairly long wait times as we've been working with one scope only, which has allowed only 4 patients per day to be treated. With the addition of a second scope, we'll be able to treat up to, provide endobronchial ultrasound services for up to 7 patients per day, which would one, expedite the diagnosis for patients requiring urgent diagnosis and reduce the wait time required to achieve an accurate stage of their lung cancer, and then ultimately go on to reduce the time it takes for them to go on to get treated. Certainly coming through with an endobronchial ultrasound scope is a piece of equipment that we can use on a weekly basis to try to better define people's diseases, diagnose them and stage them, and then ultimately go on to the treatment is going to have a big impact on Nova Scotians. Donations will be doubled, and this will make a huge impact on helping to treat and manage patients with lung disease.